The state of Nevada finds itself at the heart of a new public health concern. A dairy worker has contracted the D1.1 strain of bird flu. This incident marks the second confirmed instance of this particular strain, leaping from birds to cows. The Centers for Disease Control and Prevention, or CDC, is actively monitoring the situation. They are working closely with Nevada health authorities to investigate the case and implement necessary control measures. The D1.1 strain first emerged in Nevada dairy cows just last month. Its discovery was a result of the comprehensive national milk testing strategy. This strategy plays a crucial role in detecting and responding to potential health threats in livestock. The dairy worker's infection confirms that D1.1 is capable of transmission from cows to humans. Health officials are now working to determine the extent of the virus's spread and the potential risk it poses to the public. This incident underscores the need for robust surveillance systems, rapid response mechanisms, and coordinated efforts to combat emerging infectious diseases. The emergence of the D1.1 strain serves as a stark reminder of the interconnectedness of human, animal, and environmental health. The D1.1 strain of bird flu is a variant of the highly pathogenic avian influenza virus. This virus is notorious for causing severe illness and death in birds, particularly poultry. What sets D1.1 apart from other strains is a specific mutation in its genetic makeup. This mutation, scientists believe, may be responsible for its enhanced ability to infect mammals, including both cows and humans. Unlike the B3.13 strain, which has been the dominant strain causing human infections in the US, D1.1 presents a different set of challenges. While the D1.1 strain has been found to be generally not fatal in cows, its impact should not be underestimated. Infected cows can experience respiratory distress, reduced milk production, and even death in some cases. The good news is that many herds affected by D1.1 have shown signs of recovery, suggesting some level of immunity. However, the long-term consequences of D1.1 infection in cows, such as potential effects on milk production or future outbreaks, remain uncertain. Continuous monitoring of infected herds is essential to assess the effectiveness of current control measures. Further research is crucial to fully understanding the virus's behavior in these animals. The emergence of the D1.1 strain has raised concerns about its impact on both human and animal health. While the virus has been circulating in bird populations for some time, its recent detection in cows and a dairy worker in Nevada has heightened anxieties. The case in Nevada marks the second known instance of D1.1 infecting a human in the United States. In humans, D1.1 appears to cause mild to moderate symptoms. The infected dairy worker in Nevada experienced conjunctivitis, an inflammation of the eye, and recovered without complications. This aligns with the general observation that most human cases of D1.1 infection have been mild. However, a death in Louisiana, linked to the D1.1 strain, highlights the potential severity of the virus. The deceased individual was over 65 years old and had underlying health conditions, increasing their vulnerability. This case underscores the importance of understanding the factors that might make certain individuals more susceptible to severe D1.1 infection. The CDC estimates that the D1.1 strain was responsible for 15 out of the 68 confirmed human cases of bird flu in 2024. This geographical spread indicates that the virus has established a presence in different parts of the country, emphasizing the need for nationwide surveillance and response efforts. Section 4. Economic fallout. Poultry farms and beyond. The D1. One strain of bird flu has sent shockwaves through the agricultural industry, particularly impacting poultry farms. The virus's rapid spread among bird populations has led to the culling of millions of chickens and turkeys across the United States. This drastic measure, while necessary to control the outbreak, has had severe economic consequences. The culling of poultry flocks has resulted in a significant decrease in the supply of poultry products, leading to a surge in prices. Consumers have felt the pinch at grocery stores, with the cost of chicken and turkey meat skyrocketing. The shortage of eggs is another consequence of the outbreak. With fewer laying hens due to culling, egg production has plummeted, leading to empty shelves in supermarkets and soaring egg prices. This shortage has had ripple effects on various sectors, from bakeries to restaurants, disrupting businesses and impacting consumer choices. The economic fallout from the D1. One outbreak underscores the interconnectedness of animal health, human health, and the economy. It emphasizes the need for robust biosecurity measures on farms, early detection systems, and effective control strategies to prevent and mitigate the economic impact of future outbreaks. Section 5. The looming threat, mutation, and endemicity. One of the most concerning aspects of the D1 strain is its potential to mutate. Viruses by their nature are constantly evolving, and D1 is no exception. As the virus continues to circulate among animal populations, there is a constant risk of it undergoing genetic changes that could make it even more dangerous. Experts are particularly concerned about the possibility of D1 mutating in a way that would allow it to spread more easily from person to person. Currently, there is no evidence of sustained human-to-human transmission of the virus. Another concern is the possibility of D1 becoming endemic in the United States, leading to ongoing outbreaks and posing a constant threat to both human and animal health. The potential for mutation and endemicity underscores the need for ongoing surveillance, research, and preparedness efforts. Scientists are working tirelessly to understand how the virus is evolving, develop effective vaccines and treatments, and educate the public about the risks and preventive measures. Section 6. Public Health Response and Preparedness. In the face of the emerging threat posed by the D1 strain of bird flu, public health officials are taking proactive steps to protect human health and prevent a wider outbreak. The CDC, in collaboration with state and local health departments, has stepped up surveillance efforts to closely monitor the spread of the virus and identify any new cases promptly. One of the key strategies being employed is enhanced testing for bird flu in hospitalized patients. By testing individuals exhibiting flu-like symptoms, even if they haven't had known contact with birds, health officials aim to detect any potential cases of D1 infection early on. The CDC is also working closely with healthcare providers, providing guidance on identifying potential D1 cases and implementing appropriate infection control measures. Public awareness campaigns are also underway to educate the public about the risks associated with bird flu and the steps they can take to protect themselves. Section 7. Navigating the uncertainty. As we navigate the uncertainty surrounding the D1 strain of bird flu, it's essential to remain vigilant and informed. While the current risk to the general public is considered low, the situation is evolving, and the potential for the virus to mutate and pose a greater threat remains a concern. The good news is that there is no evidence of sustained human-to-human transmission of D1 at this time. The best defense against D1 and other infectious diseases is prevention. By taking simple yet effective precautions, we can significantly reduce the risk of infection. Remember to wash your hands frequently with soap and water, especially after handling poultry or being around birds. By staying informed, following public health recommendations, and taking personal preventive measures, we can collectively navigate the challenges posed by the D1 strain and protect ourselves and our communities.